Enteral feeding is a safe way to provide nutrition, fluid, and medications to patients unable to eat by mouth. They can be used to supplement a patient's diet or as a means to provide complete daily nutrition. Tube feeding formulas may be regular strength or concentrated. Concentrated formulas should be diluted with sterile water. The amount and type of formula will be ordered by the physician or dietitian. Tube feed liquid provides a balance of macronutrients and micronutrients and contains typically 1 kilocalorie per ml. Enteral feedings may be intermittent or continuous. Intermittent feedings are given several times throughout the day. About 300 to 500 ml of formula is administered each time. The preferred site for intermittent feedings is the stomach, and they are usually administered over 30 minutes. The patient must be assessed for tolerance to the feeding. The patient is at increased risk for abdominal distension and aspiration with bolus intermittent feedings. Bolus intermittent feedings are administered rapidly through a syringe without a plunger using gravity to control the rate of flow. This is an example of an open feeding system. Continuous feedings may be delivered through an open or closed administration system. Proper procedures must be followed with each. Continuous feedings are administered non-stop over 24 hours using a pre-programmed pump to ensure a consistent flow rate. The feeding may be delivered to the stomach or small intestine through a small 4-bore feeding tube. Slower administration reduces the risk of cramping, nausea, and diarrhea. Cyclical continuous feedings occur over less than 24 hours, most often at night. These feeds are nutrient-dense and administered more rapidly than regular continuous feedings. Therefore, it is important the patient be carefully monitored for fluid status and circulating volume overload. Patients receiving tube feedings must be assessed for side effects and complications. These include abdominal distension, regurgitation or reflux, diarrhea or constipation, hyperglycemia, dehydration, and nutrient imbalances. Laboratory values should be examined regularly. Hematocrit and urine-specific gravity indicate fluid status. Serum, blood urea nitrogen, and sodium levels indicate kidney functioning. And glucose regulation tests indicate blood glucose levels. Another less common but serious complication is dumping syndrome. This produces weakness, dizziness and fainting, sweating, nausea, cramping, pallor, heart palpitations, and increased pulse rate. This is a result of osmotic pressure moving fluid from the vascular system to the intestinal system as a result of hypertonic feeding. Before initiating tube feeding, the patient must be assessed for contraindications to the procedure. These include allergy to ingredients, absence of bowel sounds, abdominal distension, nausea or vomiting, or a gastric residual volume of 50% or higher of the previous feeding. Each agency will have policies and procedures on how to handle these situations. When initiating tube feeding, appropriately position the patient, verify the placement of the tube, and administer the feeding according to the system. When complete, document how correct placement of the tube was confirmed, the amount of residual volume, the type and amount of feeding given, and the duration of the feeding. The nurse should also document any side effects and complications noted before, during, and after the feed.